Welcome back to our series looking at Addison's response to the COVID-19 pandemic. We are about 1 week removed from the governor's order for shelter in place, and so over the last week, many of us have changed our routines drastically, if not even before that week. A higher percentage of people are working from home. If they have to go into work, they're practicing their social distance. They've changed a lot in their practices. But some people who can't really have that luxury are our first responders. So here to talk about how operations have changed and how much they stay the same are Commander Roy Selvik from the Addison Police Department and Fire Chief Scott Walker. Gentlemen, thank you for coming in. I know the two of you are really, really busy. As I said, we'll start with the police department. I know that you have done a little bit of changing, having to prioritize things. And before we go into those changes, I wanted to talk a little bit about why. Because when a resident hears you're prioritizing things, I think their first reaction is, well, if I'm calling, it's obviously important. So talk to me a little bit about why you've changed some things.
So given the current pandemic that we've been facing with COVID-19, our number one goal is to safeguard the community and the residents, but also to keep our officers safe. So what we've done is change just a few things in the way we operate, our day-to-day operations and our calls for service, so that we're still maintaining the level of safety that we provide to the community, responding to all those calls, handling all the concerns, at the same time trying to minimize a lot of that contact that everyone's been hearing about, keeping socially distant, and kind of putting in a big priority, okay, what's emergency, what's not emergency? What are some things that can be handled over the phone? What are some things that can be handled maybe through a conversation through a door versus what are the emergency things that we still have to handle as we normally would?
Okay, so let's start with high priority. What qualifies as an emergency, and if are there any changes to how you handle those emergencies?
So all those high priority emergency type calls, there are no changes. We handle those just as we normally would. Those types of calls include everything from crimes in progress, crimes against persons, your aggravated batteries, your robberies, your things where they're unfolding as we speak, as the calls are coming in. And there's some reason that we have to respond to those with immediacy to take control of the situation. They also include types of calls where it warrants an officer to have to respond to the scene. And some of those could be something that somebody came home and found their home burglarized. Well, we need to respond to those because we have evidence duties that we have to perform. We have collection that we have to do. All these types of calls are handled just as they normally would. We encourage citizens to call 911. Don't hesitate. If it's something where you absolutely need an officer to respond right away, we're going to respond. We want to make sure that the citizens are safe, and we don't want them to question in that moment, hey, is this one of those calls where maybe I should just show up in the lobby, or I should call a non-emergency number because of what's going on with this pandemic. We would stress that if you're in doubt, treat it like an emergency and call 911, and we'll respond appropriately.
And Deputy Chief Moranowitz earlier this week mentioned that there's some additional questions that you might be asked by dispatch when you're calling 911. Let's remind the community of some of those questions that they're going to be asked that they're not used to.
Sure. So our dispatchers are highly trained, just like our officers, and especially now they're kind of following a bit of a script in what to ask when someone calls up. And they know generally from right away in the first few moments when somebody calls 911, okay, is this an emergency or is this something that we can gain some information and have somebody contact them back? And people don't always know that, especially if they just came home and found their car broken into. That could be the worst thing that's ever happened to them, and they might be likely to call up and say, hey, you need an officer right away. Well, some of those things we have to take into account. Okay, what's the danger here? What's the immediacy of sending our officers in that contact with the community and possibly exposing more individuals to this COVID-19 versus, hey, is this something we can handle over a phone? So what our dispatchers are doing is they're assessing the callers and saying, okay, what is exactly going on? Where are you? Is there somebody on scene? And again, their goal is the same as ours. Is this in progress? Do we need to have an officer there right away? Or is this something that we can have an officer contact them back? And if we need to send an officer to the scene, we can use the supervisor discretion to kind of filter that out a little bit.
And if they have to go, are you asking, is there anybody who's perhaps sick in your household? Have you done any travel, that kind of thing?
Correct. So some of the COVID-19 questions a lot of people may have seen in all over the news, the media, they're going to ask, hey, is there anybody that has tested positive for COVID-19? Is there anybody exhibiting symptoms? Are they coughing? Are they sneezing? Are they having respiratory issues? Is there anybody in your household or business that may have traveled outside the country in the last 2 weeks? So all these types of questions they're going to use to then notify our supervisor to say, hey, this is what we have at this location. Do you want an officer to respond as normal? And then also inform the officers that are responding, hey, there may be somebody there that has the potential or confirmed case of coronavirus, and then they will use the equipment that they have appropriately.
Okay. And now what are those lower priority calls that perhaps instead of showing up in the police department lobby, you can handle over the phone now?
So the lower priority calls are pretty much the calls that it's not an emergency where an officer needs to be there right away. And they could be everything from a traffic crash where there's no injuries, there's no vehicles blocking the roadway, it's just a fender bender that occurred where the vehicles pulled off the side of the road. It could be something where it's a delayed theft. Somebody had their purse grabbed off the counter at a location somewhere. It could be something, any of those calls, those low priority type calls, ordinance violations. Cars parked across sidewalks, loud music, all that kind of stuff where the officer will handle it appropriately, usually, maybe with a phone call. But those are all things that somebody doesn't have to respond right away, so that we can try to limit that contact.
And I'm sure you're encouraging maybe a little bit more patience with others.
We are. We are. We're stressing as much as we can to the public that these are tough times. And they're tough times financially to a lot of families. We're coming across more and more people that are laid off, they're out of work. People are home for whether they're working from home, whether they've been laid off. So we're stressing as much as we can to the community. Just be patient a little bit and keep into account that you may have neighbors, you may have people in the area that are home, kids outside playing that aren't usually there. And some people aren't accustomed to this. People out going for walks that aren't usually out going for walks. I see a lot of them lately. So just be conscious, especially little things like parking across the sidewalks like that. When you have families trying to walk their dog around the neighborhood, and usually there's nobody out in that neighborhood on a normal day.
Now, Scott, you unfortunately don't really have the luxury of, maybe this call we can handle over the phone. Usually when the fire protection district is needed, it's something urgent. So lead me through the beginning to end of a 911 call, because while what you're doing is the same, I'm sure, the way you're going about it is a little bit different.
And that's probably the hardest part, some of the changes we need to make. So we share the same dispatch center, so those same questions, no matter what you call for, the same questions are being asked. So if you have a fever, have you traveled, have you been in contact with somebody that has the COVID-19? So that's how it starts. Whatever that individual is telling dispatch, that gets relayed to us on the radio. And then that will dictate who we send into the house and then what we're going to wear as we make entry into the house. And just like the police, we have different levels of calls too. So if somebody has a cut finger, that's going to be one guy in our first level of protection. If it's somebody that's has a fever or shortness of breath, we're going to go in with the next level right off the bat. If it's somebody not breathing, then we're bringing in multiple guys. We're in the highest level of protection. But by far the hardest thing, and I know this is true for the police too, is we're so used to getting that call, and we send in, with the police 6, 7, 8 people into a house for somebody that needs help. Now it's maybe 1 or 2 people, and then the rest of the guys and gals are standing outside, and that's by far been the biggest adjustment for us.
And that's important, but people should keep in mind that it's not that you guys are, slacking off or anything. That's for your safety, that's for the public's safety.
So we don't want to bring anything into their homes. As everybody knows from the news, people can have it and not show any symptoms. So we're trying to limit what we bring into homes, and we don't want to bring whatever's into the house back to the fire station. So we try to do a measured response. Everything we do does not change the level of care anybody gets, nor does it change our response. So we're not any slower than we were 3 weeks ago, and we're treating everybody the same. It's just trying to gauge it in a different way that we're just not used to. We never got used to looking at it that way as far as holding people back. So it's been an adjustment, but it's been long enough now that it's, and same thing with the police. I'm sure we're kind of like a well-oiled machine now. Everybody's used to the new normal, which it is. So it's pretty smooth now.
So you mentioned that you'll still dispatch. Some of the people may stay outside while you're evaluating the situation. Talk to me a little bit about this protective gear.
So the first level, so no matter what call we go on, our paramedics and our firefighters are always going to be wearing a mask.
So don't be alarmed.
Don't be alarmed. A cut finger and you're wondering why guys are walking in your house wearing masks. For the mere fact we don't know who has it. Maybe somebody did have a fever and they're not relaying it to dispatch properly. Or like I said, somebody can have 0 symptoms and have it. So the first level is something simple like this. You've seen it on TV, just a regular surgical mask. So we'll just say a cut finger, our guys will walk in, they'll put one of these on the patient as well. So don't be alarmed if they're putting a mask on you, if you call. The next level, and I know there's been a lot of talk on the news about N95 masks. So everybody knows this is an N95 mask. So what's interesting is this is actually considered a respirator, and it actually knocks out almost 100% of the particulate. So that's why this is desired if we're actually encountering a patient that has COVID-19. What's not really disseminated in the news too well is the reason why these aren't kept on hand. They do expire.
Really?
So they do. So it doesn't make sense, and we don't really wear them that often. So normally somebody with tuberculosis, some of the more uncommon medical conditions, that's why we have to have them. So no fire department, no hospital is going to have thousands and thousands of them laying around, because odds are after a certain amount of time they're going to have to get thrown out.
Okay.
So I know a lot of people probably never heard that before. So, and another thing interested is you're supposed to get fitted. So there's multiple sizes. So the first responders, when we wear these, I know what size I'm supposed to have. So that's our second level of protection. Our last level, and we have not gone to this, and I know this one's a little bit more on the scary side, if you will. So it's called a millennial mask. So this would be worn if we run out of these, and I know if you have turned on the TV, that's all you hear about is we need more masks, we need more masks.
Right.
We're no different. We don't have an endless supply of these. So if we do run out and the current situation continues, there is a chance that we'll convert our crews into these.
Okay.
So this is a millennial mask. A little more intrusive to the person. So I just want to bring this up and show everybody that if you see our guys in this, it doesn't mean that we think you're sicker than somebody else. It doesn't mean that we know something that maybe you don't know. It's just we truly do not have any more of this type of equipment. So, the only other scenario too is if we have a really, really, really sick patient that we know has it for sure, the guys might decide to wear this because it's the face and respiratory protection in one. Instead of wearing a mask, the glasses, the face shield, basically one piece of equipment does it all. So I just thought it was important to bring this so the community can see this.
Sure.
And that's pretty much it. So
you said right now your supply is good?
Yes. Yeah. So like I said, we started out from the very get-go, we started the program of using the surgical mask first. So some area departments started using this first and started burning through their supplies quicker. Everybody around here is on the same page now, so we know these have got to be conserved. So by all means, if we need them. So some examples, if somebody just calls them and says they have a fever, our guys are going to be wearing this automatically. Somebody has shortness of breath, they're wearing this automatically. But like I said, if it's the cut finger, we start out with the first level, but as the guys walk in and they approach the patient and they start asking the same questions that dispatch asks, if somebody says, you know what, yes, I have a cut finger, and by the way, feel like I have a fever, the guys will then switch into this mask before they get within the 6 feet that everybody's so used to hearing about.
But I think it's important to note, and it may sound common sense to some, but it's important to note that you should be honest about it.
Yes.
It's not like you guys are going to say, well, we're not going to go to your house. You just quarantine.
There's nothing somebody can say to the dispatch center that's going to prevent either the police or the firefighters from coming. So you can have COVID-19, be extremely sick. The firemen and police are coming. Other than the few changes that I said, and we try to measure our response as we enter the house, we're coming, and we'll wear whatever equipment we need to wear to keep our personnel safe. But nothing's going to stop. So by all means, please, answer all the questions truthfully. And really, the sooner you answer those questions, it gives us a chance to put on the right stuff right from the get-go, and it even speeds up the process faster.
Is there any other precautions that you are taking or that you would want the public to take? Like Roy mentioned, if they respond to a home, whenever possible, they may, stay outside and try to hold the conversation outside the house. Is there anything else that you need the public to be doing?
Yeah, so if you're in your house and you're calling, let's say you're just feeling feverish or flu-like symptoms, and you relay it to dispatch, if you're able to meet the paramedics at the door, that would be better. Now, by all means, if you're too weak to walk, we know anybody to try to get up and walk if you're not able to.
Sure.
But if it's general flu and you feel like you need to go to the hospital, if you can meet them at the door, if we can keep people out of your house, again, we don't want to bring anything in, and we don't want to walk into something and bring it out of your house, that would be ideal. I also do want to stress, though, too, and I know this has been a lot in the news, if you have just minor symptoms, right? I have a fever, flu-ish, I'm pretty confident a lot of people know what the flu feels like. If it's along those lines, you're better off, staying at home if you can. By all means, if you have shortness of breath, most people know their body. If it's something that you feel is serious, that's the time to call. We're still waiting for this peak that's coming.
Right.
And, anywhere, depending on who you listen to, it's a week and a half, 2 weeks away still. We don't want to start flooding the hospitals with patients that don't need to be there. Okay. We'll take, if somebody wants to go to the hospital, we'll take them. We'll never discourage somebody. But the public needs to use their best judgment.
Right.
So, if you tell us that you need to go to the hospital because you're truly sick, then you're truly sick. But if it's something that you can manage at home, that's the better place for you. And you really don't want to go to the hospital if you can avoid it. You don't want to commingle and get sicker.
Right, exactly. So. If you're overreacting, you could put yourself in a situation where that's where you catch it.
Yeah, and also people should know too, the chances of your family getting into the hospital. So if you go to the hospital, you're not going to be able to bring family in there with you. If you wind up getting admitted to the hospital, you're not going to have visitors in the hospital. So, I don't know if people realize that either. All the hospitals are shut down as well. So, it's not like you can go to the ER and if you're there for 5 or 6 hours, you're going to be there by yourself.
Right.
So if you've got family that can help you at home, or, it's probably a better place to stay if you can.
Exactly.
So.
Roy, anything else that you want the Addison community to know during this?
I would just stress good common sense. Again, just to reiterate that nothing has changed as far as our calls for service for emergency-based calls. So don't hesitate to call us if you need us, or if you think you need us. But for everything else, just use good common sense. If it's something, like I said, can be handled over the phone, please call us. We actually have a sign posted in our lobby that if under certain conditions, if you're exhibiting these symptoms and it's not an emergency, please just call us and we'll handle it that way. And then also, for interaction in the public, if you see people congregating in parks, things like that, if it's something that you think needs police attention, let us know, and we're happy to go out there and handle it. And then also, our officers are using good common sense as well, especially when it comes to discretion, utilizing equipment. Just like with fire, they all have been issued N95 masks that they carry around with them. As of right now, it's optional, up to them based on the call, whether they choose to wear it. So please don't be offended if people put it on.
Right.
Again, just like Scott said, we don't know anything that they don't know. It's just a precaution to help protect them.
Okay. And Scott, same question. Anything else that you need people to know?
Yep, the same thing he said. Don't be offended if if people have used this before and they're so used to us getting in there and having all this personnel around them working. Don't be offended if guys are waiting outside your door. And like I said, don't be offended by what we're wearing, because I can't lose 10, 15, 20 firefighters, paramedics. The police can't afford to lose 20 people. Now we both have plans in place. If that does happen, our neighbors will help, but
we don't want to be in that situation.
We're trying to keep our personnel as healthy as possible so we can help as many people as we can until we get to the other side of the current situation we're in. So,
exactly.
Yep.
Well, thank you both for being here, and thank you for all the hard work you're putting in. You can definitely stay informed about what's going on with COVID-19 in our community. We're pushing out updates as we get them. Visit addisonadvantage.org. Up at the top, we've created a new tab, COVID-19, and it has an abundance of information specifically for seniors. It has information about closings in the community, things that are still open, as well as a bunch of resources externally like the CDC and the DuPage County Health Department. You can also like our Facebook page, Village of Addison, or follow us on Twitter, Addison Village. And we encourage you to sign up for Code Red updates in emergency situations. That is the fastest way for us to communicate to you what you need to know. Lastly, download the free mobile app, Addison Connected, which has all of this information on there, the information on the website as well as social media. Thank you for being with us. We will be back next week with additional updates about Addison's response to COVID-19. I'm Dory Croggy. Thanks for being with us.